Hello, everybody. Dr. Mellick here. I am doing my second Facebook Live post. We'll see how this goes. I'm a little bit late because very typical of me. I do something once and then I completely forget how to do it. So anyway, I apologize for being a little bit behind schedule. But today is Friday, July 3rd. Getting ready for the 4th of July here, obviously, and hope everybody has a great 4th of July. And today we're going to really talk a little bit about teaching your child some medical independence and debunking and explaining a little bit the adolescent visits at your pediatrician's office. We get an awful lot of questions about what we're asking these questions for and why we ask the questions that we ask. So anyway, hopefully this will help answer some questions. I didn't see any questions posted on the thing that we had sent out earlier this week, so if anybody has questions, please just go ahead and toss them up. I'm trying to watch as I go along. Before I start with that, though, I really wouldn't be doing my job correctly if I don't remind everybody that with the 4th of July comes an awful lot of injuries and a lot of fun, but some injuries as well. So usual 4th of July stuff, be cautious with watching your kids if you are going to go out and watch 4th of July celebrations or have 4th of July celebrations with friends and family. Do remember that we're living in some weird times, and be cautious about social distancing and sharing of food and that sort of thing as well. But I like to joke with the kids that I see around this time of year. I always say to them, okay, everybody, hold up your fingers. Count how many you have. You have 10, okay? Let's have 10 July 5th as well. I had I don't know if it's an unfortunate experience or the luckyhood of working at Children's Mercy when I was a resident on the night of 4th of July. And I saw some incredibly sad, really scary things that came into the ER that night with some kids and fireworks or 4th of July injuries. So remember, sparklers are really hot. They cause third-degree burns. Even if they're not going, they stay hot. So make sure that you have a safe place to do sparklers if you're going to with your kids. Please don't set firecrackers or light them in your hand, okay? I've seen blown off fingers, all sorts of issues with that. I was just talking with a nurse at one of the hospitals I was rounding out this morning about her husband and his healing that he's still doing from last 4th of July. Apparently he had a little bit of issues with some PTSD last night because of the 4th of July stuff that was already happening. So just think that as you're starting to light stuff. I don't care how cool you are, dads and moms, don't light things in your hands. The other thing that I tell kids is that these are cool and they're pretty and they're fun, but they're not toys. The worst injury I've ever seen was bottle rocket in hair, lit the little girl's hair on fire, third-degree burns. So just don't shoot them at each other. It's not funny, okay? So make sure your kids know that. All right, so let's talk a little bit about adolescent visit. I think to start, I'm going to have to start with the fact of what exactly is our goal as parents and what is our goal as pediatricians. And I think the ultimate goal that I have as a parent and I have as a pediatrician is to raise my children to become healthy, autonomous adults. All right, that means in every aspect of their life. Not just the fact that I don't really want them living in my basement forever after they've graduated school, gotten married, and had children. I'm very excited to meet my grandchildren at some point in my life. But I don't know that I want to be their parent. I want to spoil them. I want to let them eat things that they shouldn't as long as they brush their teeth and as long as it's in moderation. And I want them to stay up past their bedtime at my house. I don't want to raise them, so I don't want them living in my basement. So my job as a parent is to make sure that my daughters are able to function on their own. So that's kind of the overall goal. And as pediatricians, we have kind of a unique role because we start taking care of our patients at birth. And obviously, our relationship with them at that moment in time is really an offshoot of the relationship that we have with the parents. So this is where our name came from. We really are your partners in raising your children. We just help with the medical piece of it. We help with the preventative care of this. We help you all make some good decisions. So, and a lot of that doesn't come from your pediatrician. A lot of that comes from what your parents taught you. And with that, I got to say hi to an excellent parent and grandparent, my mother-in-law, Mary Mellick. So hi, Grandma Mary. She is a wonderful example, and they are resources for us as we raise our kids. So you'll hear things from your pediatrician, but as these children age, our relationship with them changes a little bit. And somewhere around the double digits to preteen visits, you will notice that not only do you see the doctors and the nurse practitioners moving away from asking parents questions, the nurses and the front office staff often start asking your children questions. This is not to cut you out of the equation, but these kids have to become comfortable talking to safe adults and giving the appropriate information. So we will ask them, what time do you go to bed? What's your favorite vegetable? Do you know where mom and dad keep medications? So sometimes these questions we ask them just light up parents' eyes with, I have no idea that they knew where we kept our gun. I had no idea they knew where the key was to the gun safe. And this isn't something that we ask to get into your personal freedoms or to try to take away your rights. It's to make sure that your kids are kept safe. So what we ask is, when we start directing our questions to your children, please refrain from the feeling of wanting to answer questions for them. I know that as parents, we want to make everything as easy as possible for our kids. I get it. But part of life is learning to handle some a little stressful situations. And it is a little stressful to go to the doctor. Even kids, if they've known their doctors for a long, long time, get scared and worried because, am I getting shots today, right? So I usually try to get that out of the way pretty quickly. In fact, usually the nurses have already gotten that out of the way. But one of the things that I recommend is starting even when they are, old enough to know that they're going to the doctor. Have a conversation with them about, hey, we're going to go see Dr. Mellick today and or tomorrow. She's probably going to want to know if you brush your teeth twice a day. And so make sure that you think of any questions you'd like to ask her about your health or your body. Let them know that we are a trusted source of asking and answering these questions for them. This really morphs a little bit, not just asking them some questions, as they get into middle school. Not only do I want them at that point in time to be able to say, this is how I feel today, but I want them to be able to say, this is my health history. So I had my tonsils taken out when I was 6. And I know that seems a little bit silly because at 10 and 11, they're probably never going to go to the doctor without you, and that's wonderful. But this is a stepwise process. This is a progression towards independence, not just complete and total independence. So let them learn those things about themselves. Do they have allergies? What are those allergies to? The other thing you have to remember is that a lot of these kids are at school and would maybe end up in a school nurse office. And if they have medical history the school nurse isn't aware of, though she should be, they need to answer those questions. Or let's say that on the soccer field, your child goes down and is having trouble breathing. Maybe they got the wind knocked out of them. Maybe they have asthma. Maybe if they have a cut, they have a bleeding disorder or an infectious process that they need to be able to help protect other people from. So I want them to be able to know those things so that they can answer these questions. So middle school, kind of learning their own medical history. As a child gets into the teenage years and the high school years, we at the doctor's office like them to start becoming a little bit more independent about their own body. We talk a lot about respect. It's sort of how we base our safety talk as well, right? We want people to respect their bodies, which is why when we have to do private exams, we ask permission. Usually when they're old enough, we ask permission, or we at least tell the child, like the 5 and 6-year-olds, doctors have to check private parts too, but it's only okay when mom or dad is with you and they say it's okay too. I had a little kid yesterday say, when I asked that question, because a lot of times I'll say, why do I ask you this question? And they say, because these parts are private. And they said, well, you have to ask my mom and dad too, at least until I'm an adult. And then I get to say. And I said, that's right. This was a 6-year-old. It was the cutest thing. So they start to learn this stuff. And they also learn who's safe, right? So I know that parents will often talk about private things and that this is the people that can check these places. I usually tell you not to give a global okay. So I sometimes hear parents say, who gets to check these areas? Doctors do, okay? No. Doctors don't check these areas at the ball field. Doctors don't check these areas at the skating rink. And kids believe people when they say that I'm a doctor. I mean, what are they going to ask? To see my medical license? I'm not going to check my patients out on the soccer field anywhere private, or, I mean, I'll check an ankle if necessary, but that's not where I do my doctoring. Out there, I'm somebody's mom, usually. So don't give a global okay. Just, it's okay for doctors to check, at least when they're littler. But then when they get older, we talk a lot about respect. And so I am going to respect my patients and their body. And they should expect other people to respect their body. And as they get older, they themselves need to respect their bodies. So they need to eat healthy foods. And vaping is not good for you. It's not good for your body. And that you're not respecting your lungs if you do that, or if you smoke, or if you chew. Drinking alcohol before the age of 21. It's not just some random law. Your brain is not fully developed until you're closer to your early 20s. And there's some evidence to show that kids who use drugs and alcohol before the age of 21, they're 9 times more likely to become addicted than an adult. So this is something to talk to your kids about. And this is something we'll talk to your kids about. And we are never going to overrun your ideas, but we want these kids to be able to talk with us and to know that we are safe places to go with their questions. So in high school, we start offering some time for them to talk to us privately. Now, we don't necessarily require this. Some kids are just super uncomfortable. They just are. And at 14, a 14-year-old might be so comfortable talking to me that they don't want their parent in for any of the visit. Usually I at least like them to come in so I can hear what the parents' concerns are. This is more rare in this area, but I have also in residency taken care of a newborn in the hospital of a 14-year-old mother whose father was 15. So I think we have to make sure that our heads are not stuck in the sand and act like our kids at 14 have no idea what sex is, okay? Many of them have a better idea of what the kids are doing in school and their friends, and then you have any idea. It's very interesting, sometimes eye-opening. So we want them to have some time that is offered to be by themselves with us. At 16, whether or not they feel comfortable with it or not, I typically kick out a parent. And I think most of my partners do the same thing. I mean, obviously there's going to be some exceptions to this. Kids who are developmentally delayed, or if there has been some issue. These are not hard and fast rules. So, but we give them sort of that heads up. I usually say, would you like any private time with me? Because I want them to learn that they're going to have to become able to do this on their own. Sometimes when I kick the parent out, and most of my parents are fine with it, the kid will look at me and I'll ask them, is there anything you'd like to talk with me about? And I get, nope, and that's it. And then we'll say, well, how's school? How are friends? You know, and sometimes that perks something, and sometimes it's literally a 2-minute conversation. And they're off on their way. Sometimes it's okay, I really do want to ask you a question. And I have gotten every question, from questions about using drugs, about a friend that they're concerned about with anxiety and depression, questions about their sexuality, questions about questioning gender, questions about why is drinking bad, questions about I am vaping and I think that I'm addicted. And my goal is never to keep secrets from the parents. I always try to explain that their parent is their biggest advocate and their biggest ally, and usually I can get the child to then share something that I think needs to be shared with the parent with them. But legally, at a certain point, they have the right to share with their physician things that are private. We are required to let parents know if a child tells us that they are wanting to hurt themselves or hurt someone else. Those are things that are required. But if they tell me that they are smoking, if they tell me they're vaping, if they tell me they're having sex, I will keep their confidence. Every physician and nurse practitioner in our office is going to counsel them on the safety of these things and the risks that they're taking, and that we really do encourage them to share with their parents this so that they can have their help. But I would much rather that they hear that condoms are not 100% effective from somebody they might believe, and that they should have alternate forms, and that the only absolute way to not contract a sexually transmitted infection or to become pregnant is abstinence, which is going to be exactly what we'd say, because that is the science. We are scientists. This is what we teach. That all being said, I completely and totally recommend that parents start having conversations about all of these things, about puberty, which is not a dirty word, by the way. One of the things that we really, really want you guys not to do is come in and dance around a topic, right? Do this. This is crazy. So parents will come in and they'll be like, so we really haven't talked about puberty yet. And I'm like, okay, so puberty is this. And I want it to not be scary, and I want it to not be a silly word, and I don't want sex to be a word that is taboo in your family, okay? Hi, Christine. Good to see you. Just be so happy you don't have to have these conversations for lots of years yet. But lots of years is not that far off. It happens quickly. But I've always told my kids, hey, Trisha, I've always told my kids, I want you to ask me any question that you need to ask me, and I will never, ever not answer your question. So I always tell them, you ask me a question, but be sure you want to know the answer. I mean, I'm not going to necessarily give them this whole dissertation at 10 when they ask me what sex is about, well, it's this. I want you as families to answer these questions at the appropriate age and appropriate level, but don't dodge a question. Don't tell them I'll tell you when you're older, because to me, that is going to set them up for, well, okay, my parent's not that person who's going to answer that question. They're going to go Google it, ask Siri or ask Alexa, and you may not like what comes up on that search. So start talking to them about puberty. If they ask a question, answer it honestly, but answer the question that's asked. You don't have to expand and expound, but these are conversations that are ongoing. Share with them about your family history. I'm not talking necessarily about things that are private between you and your spouse or you and your past, but I want them to start to learn about their family history. Eventually, they are going to be without you somewhere. I had a situation where I was traveling with my daughter for soccer, and one of her teammates had a pretty significant injury, and her parents weren't able to be there. So, I mean, cell phones are wonderful. Thank God for cell phones, right? But this kid wasn't 100% certain if there were any bleeding disorders. She was going to probably have to have sedation to have something set. And she didn't know if there was a family history of problems with sedation. She didn't know any of these things. So, and she was 15 years old. She should know these things, right? God forbid your child ever has to accompany you to the hospital because your spouse or someone else is not with you and has to be the one to give your history. But this is their family history. So, you know, these are things that I want them to start learning. I want you guys to also not be afraid to talk to your kids about not drinking, about not smoking, about not drinking and driving, and if they've made these mistakes, what to do if they're there. So if they find themselves at a party and they have drank and they shouldn't have, but they have no way to get home, you should be their first call. And so, and if they're at a party and they are uncomfortable with what's going on and they don't know how to get out of it, because this is hard, right? It's sometimes hard as an adult to go against what people are saying that you should do. I think we're all seeing that right now with COVID and masks, right? Should I mask? Should I not mask? Am I acting like a big baby if I have a mask on? No, you're not, by the way. Wear a mask. But how do they get out of that? So my daughters and I, we have, and this isn't a big secret, but whatever, we have a code that they can text me, and it's an emoji, and I'm not going to tell you what it is, because if any of your kids are friends with my kids, then I don't want them to know what it is, but they text me something, and then guess what? I lie for them, which means that I then text them, and I go into Mean Mommy, and I'm like, get home, I told you you were supposed to clean your room, and you didn't do it, and you're grounded. So if they've driven, they get themselves there. If not, then I will go pick them up wherever they are. So there's sort of two rules with this, right? I'm going to do this for them, and I'm not going to then, number two, require them to tell me why it is that they called me, because I don't want them to have to rat out their parents. My job as a parent is not to parent everybody else's kid, okay? So if other people's kids are doing crazy stuff and mine wants out of there, I'm going to get them out of there without making them rat out their friends. So far, I have only had to use this once with my children. Now I have, let's see, how old are the girls? Everybody's older than 13, 16, 18, and 21 right now. My oldest at one point in time sent me the signal. I told her she needed to come home. She came home. I said, do you want to talk about it? She said no. What I found out later, because now we're several years past this, was that she was at a friend's house who we trusted. The parents were going to be there. She was going to be spending the night. However, the parents were going out to dinner, which we knew, which we were fine with. These girls were fine. Well, her friend invited a boyfriend over. Boyfriend and friend were in the bedroom doing none of my business, because it wasn't my kid, not my patient. And my daughter was left there with this other boy who was making her very uncomfortable. And she just wanted out of there. So she sent me the little signal. I got her out of there, and she came home and she saved face, and I had no idea what was going on with the other friend. And we can all decide whether or not we have to tell our friends if we know their kids are doing things they wouldn't agree with. That's not a medical thing, so you guys can make that own decision. But it's important for you to let your kids know what you are comfortable with and what you don't want them doing. Studies show that the number one reason that children delay alcohol use, drug use, vaping use, and the onset of sexual activity is because their parents tell them not to do it. So the other thing that I'm really this is a plea from me as a parent to the rest of you out there, only because I know so many of you guys on here have kids my age, and actually I think some of our kids are friends. Don't be the cool parents. Stop having parties at your house where you let kids drink. I'm sorry. This is illegal, unsafe, and as far as I'm concerned, unethical. Our job is not to be cool and our kids' friends. Okay? I'll tell my girls all the time, I'm not your friend. You have plenty of friends. I'm your mother, and I'm the only one you're going to have. And I love you more than your friends do. So I maybe am going to be friends with my daughters when they are adults, but only if they're nice to me, because I'm not friends with people who aren't nice to me and haven't been since high school. That ended in high school. So I think everybody knows what that means. So talk to your kids, you guys, and know that we really are safe people to talk to and to allow them to talk to us. So we ask them at these adolescent visits about things without you in the room, and we may not share it with you. I'm going to ask them if they're having sex. And if they say yes to that, I'm going to ask, do your parents know, and how would they feel about that? And then we're going to have a conversation about why they're making that choice. I'm going to talk to them about how to safely be at a party. I'm not going to talk to them about how to drink and get away with it so their parents don't know. But I've seen too many of my patients date raped. And it is horrible to look at and to hear about, and they were putting themselves in situations that they shouldn't have and didn't often know how to get out of it. Some of them were given things in drinks that they didn't know was there. So we talk, and I teach my patients, if you didn't open the drink, if you didn't pour the drink, if you walked away from the drink and came back, you are not drinking it. And I don't care if it's bottled water. That's the truth. I don't want them drinking. That's not my point. I tell them not to. But if they're going to, they better have somebody who's watching out for them. So that's kind of the reason that we ask these questions. We're not trying to pull one over on you. We're not trying to keep secrets, although we will if that's what they ask us to do. But we are trying to teach them how to make safe choices. Our kids grow up faster than we'd like them to. There's studies that show that kids initiate sex a lot earlier than we think, and personally I can tell you that this is the case. I have parents who very adamant that their kids have no idea even what sex is, and you ask these kids and they know a lot more. And I'm not telling them that I say, okay, do you know what this is? I usually say, I usually ask them about their friends, because you can get a lot of information. I don't need names, I tell them, but what are your friends doing? And how do you feel about that? Have you tried that? So, I learn stuff all the time, you guys. So this is the way I'm going to stay cool and hip. I never really was cool and hip, and I'm still not, but at least I can speak their lingo. So give them some medical autonomy. It doesn't matter who you have entrusted to help you care for your kids, but I'd like to think that it's not just CVS to get their sports form filled out. We are there for these kids, and as I said, our role with them changes. Probably one of my favorite things, I have a lot of favorite things doing what I do, I've got a great job, but one of my favorite things is when I have a kid that is now aging out of my practice. It's very bittersweet. But when they say to me, are you sure you can't be an adult doctor and take care of me still? I had this happen last week. One of my patients who I took care of probably from the time she was about 8. And when she was 8, she was mute in my office. And I'm being serious, meaning maybe she'd nod her head a little bit, but she's now 22, graduating from college in another semester. So I'll usually see them through the end of college, traditional college, not law school, grad school, and your 4th doctoral degree. Okay, again, you guys, they age out at some point in time. But she had a great conversation with me about her life, about her boyfriend, who's probably going to be fiance soon, about how that relationship is going. And she said to me as she was leaving, we talked about next steps and what we're going to do as we find her another doctor. And she said to me, are you sure you can't take care of me a little bit longer? I'd really like to come and see you. And that was the best thing ever, right? So I hope you trust us with your kids. We're just trying to help them make smart decisions. We're not asking them to make decisions without you. I try to treat these kids like I'd want mine treated. And if you guys would like to know, my kids come and see my partners. They go in by themselves, usually. Occasionally, if they ask me, they'll want me to come in. And I completely and totally know that there's stuff that they have talked with my partners about that I don't know. And I'm okay with that because I trust these women, and Dr. Carter, he's our token man, to have conversations with them. I know them. They're good people. So happy to answer any questions I haven't seen anybody come across. I had a cute little question about ask them if they know what sex is, and then watch their faces when they realize what you did to conceive them. That's always a fun one when they figure it out. So anyway, we're here for you, but eventually our job is to care for your kids because that's whose doctor we really are. Anyway, thanks everybody. Be safe this 4th of July. Tune in next week. I believe Dr. Carter will be, or no, Dr. Ratliff I think is going to be talking to you. I'm not sure of the topic yet, but if you have any questions, please put them out there. All right. Have a great weekend, everyone. Stay safe. Bye-bye.